The right coronary artery comes off the ventral sinus of Valsalva, the anterior aspect of the aorta, and courses in the right atrioventricular groove. In this anatomical specimen, turn slightly into the left posterior oblique projection, we can see the course of the right coronary artery, and we note the presence of the right coronal artery, which crosses the ventral aspect of the right ventricular outflow tract. Note that it eventually continues with the posterior descending branch, and that in front we can see the terminal branches of the left anterior descending coronary artery. This left posterior oblique coronary angiogram shows a large branch that comes off the right coronary artery. Is the sinoatrial branch, and it is the first dorsal branch coming off the right main coronary artery. Note that it gives off some atrial as well as right ventricular branches and eventually ends in the vicinity of the crux of the heart. In this particular patient, there was a very small posterior descending right coronary artery. The back of the heart was supplied primarily by the distal circumflex branches. In this other left posterior oblique view, there is a very small right coronary artery which ends in the proximal portion of the interventricular groove posteriorly. The posterior descending coronary artery is very small. This patient had a dominant left system which supplied the back of the heart. In this other left posterior oblique view, we see the right coronary artery with anterior right ventricular branches, and note that it ends in the inferior posterior aspect of the heart. Again, a very small posterior descending coronary artery, and note that there is a superior convexity from which the branch to the AV node arises. And this is the region called the crus of the heart, which is the junction of the posterior aspect of the interatrial and interventricular septa. These next images are of the right coronary artery seen in the right posterior oblique projection. The anatomical specimen was rotated about 45 degrees. We see in blue the branches of the left coronary artery, and in red branches of the right coronary artery. Note the right coronal artery, which crosses from the right to the left coronary system and is seen in the ventral aspect of the right ventricular outflow tract. This is a potential collateral pathway that we will discuss later. In the coronary angiogram, in the right posterior oblique view of a dominant right coronary artery, we see a right coronal artery coming off ventrally and a sinoatrial branch coming off dorsally. The large size of the coronary artery is a reflection of the blood flow. It was a dominant right system supplying the posterior aspect of the left ventricle. Note that the right coronary artery extends beyond the crus of the heart, and distal branches supply the posterior inferior aspect of the left ventricle.